Tere tātou te whānau. Thank you for joining us this afternoon. I will open with karakia. Whakatakita hau ki te uru, whakatakita hau ki te tonga. Kia mā kina ki uta, kia mā taratara ki tai. Ahia ki ana te atakora, he tio, he hoka, hi hauhu, ti hei mori ora. Thank you for joining. Lovely to see you online after a little break last month whilst I was taking some annual leave and catching up with my whānau overseas. Few bits and pieces, and I will try to leave some time as well for any questions or any topics that I've not covered. Feel free to pop them in the chat as I'm talking, or when I get to the end of my updates, you can put your hand up and we can come to you on the screen as well. But if you prefer not to do that, feel free to put your questions in the chat. I just want to open and by acknowledging the industrial action that we've had over the past 2 days by our senior doctors and dentists that are members of ASMS. And just want to thank everybody for everything that you've done to help during the industrial action, either helping the run up to that and the planning, working during the strike, and the couple of days afterwards. We know is always a bit difficult to get back into business as usual and catch up with some of the work that we've deferred and some of the care that we need to provide to our patients. Particular shout out to our booking and scheduling teams. They have to do a massive job every time we have industrial action to contact patients that have got their appointments booked or their surgery booked, inform them of the strike and the cancellation of their appointments, and then rebook them as soon as we're able to. And so just acknowledging the amazing work that they do behind the scenes often to get our patients their appointments. I think I speak for all of us when we say that we hope that we get to a settlement between Health New Zealand and ASMS soon. I know that Health NZ is committed to working with ASMS to get to a settlement of the collective agreement for doctors, and we hope that that happens soon, and so that there's no more disruption to us and our patients. I just want to also talk about the Scientific, Technical and Allied Health Awards. Unfortunately, I wasn't able to get there, but I've seen some amazing photos from the event and heard from some of my colleagues them talk about how fantastic the night was. So huge thanks to the STAR team, and particularly to Hannah McCarrison, our Chief Allied Health Scientific and Technical Officer, for all their work in pulling the events together and organising it. There are too many finalists and winners for me to congratulate here, but I've had the pleasure of reading through all of the nominations, and it's just amazing to see the work that goes on across the organisation by our allied health teams, and the innovation, the dedication to our patients and our services. And so huge thank you to all of them, and a huge thank you to you that help make that happen and work with our allied health teams. I will just call out though Eliza Thomas, who I guess is the overall the supreme winner of the STAR Individual of the Year. So those of you that don't know her, she's a cardiac physiologist and has been working as our only cardiac physiologist here up in Taitokoro. So has taken on a huge amount of work, but has demonstrated absolutely outstanding effort to not only deliver a cardiac physiology service, but also deliver that in a way that helps us reduce the inequity. So providing access to patients across the Northland and across the district, with a real focus on our rural communities and those that might find it hard to access services otherwise. So huge shout out to Eliza for all of her hard work. Thank you to the team and the people that nominated her for the award, and massive thanks again to our allied health scientific and technical teams. If you want to have a look at some of the photos, they're on Staff Central. Do have a look, and you might recognise some of your colleagues or people that work in your team. So do take a look, and do take the opportunity to thank and acknowledge them if they're in your service, or if you bump into them in the corridor. You may have seen an email recently from Dale Bramley, our Chief Executive, regarding the patient and whānau support policy that's been released by Health New Zealand. This is a national policy, and it replaces all of the local policies that we might have had in place previously around visiting or whānau access or family access for patients in hospital. This is being rolled out across the country, and will enable a nationally consistent approach to whānau support and visiting. One of the major things in the policy is standardising visitor hours, and in some places that will mean opening up visiting hours where they might have been a little bit restrictive. I think during COVID we had a scenario where we reduced visiting, and as we've stepped out of COVID we've relaxed that and we've increased visitors, but it's meant that we've got inconsistencies between wards and departments, and certainly inconsistencies between hospitals and districts and regions across the motu. So what we want to do is have standardised access, so it's really clear to everybody, wherever you are in the country, what patients should be able to expect of being able to see their whānau. And we know that whānau being with patients is a significant component to a positive recovery. We know that whānau access to patients actually results in reduced length of stay. And for some of our patients that are displaying behaviours of concern or confusion, we know that having people that they know and love and trust with them in hospital really helps improve their experience whilst they're with us. So the aim is for general whānau visiting to be between 8 AM through to 8 PM. There will be some exceptions to that, and there will be some units that have different approaches to that, and there'll be some that have 24-hour access for other reasons. The policy, though, introduces an opportunity for patients to specify an individual that could be with them for 24 hours of the day, or to be with them at different times across that 24-hour period. Obviously, this is a bit of a change in many places, and so we're going to need to step through the implementation carefully. We've not fully implemented the policy. It's been released now with an expectation that each district and each hospital work through an implementation to the policy. So what we're doing at the moment is building up the team across Taitokoro that are going to be working on this and rolling that out gradually over the coming months. So expect to see a little bit more information. We'll obviously be talking with our inpatient teams around this and what that means, and working particularly with our nursing colleagues around how we support the opening up of whānau access and how we implement some of the other changes that are in the policy. But if you're interested and fancy reading it, it's available on the national internet, Te Harenga, so do have a look. It is there, and along with Dale's original message that went out. One of the other areas that I've been spending a little bit more time on recently is around health and safety and staff wellbeing. So we've reinvigorated our district health and safety committee. So that's the big decision-making committee for Te Taitokoro for health and safety. So all of the other health and safety committees across the organisation should feed up into that. What we've identified is that we haven't necessarily got good health and safety committee structures in place in every directorate. So what we're asking is that each directorate will establish their own health and safety committee, and that should pull the information and the intelligence from our health and safety representatives across all of those services and really be a very operational and problem-solving group for a directorate. But any issues that are too big or require a organisation-wide change, for example, or they need to escalate because of the risk, will come through to the district health and safety committee that I chair, and has health and safety representatives on that, as well as our regional health and safety and occupational health colleagues joining us on there. But one of the things that we've identified is that our incident reporting rate probably isn't as high as we would expect it to be for the number of people that we employ and the number of patients that we see. So we are likely underreporting some of our incidents, and some of them that stand out to me, sadly, are violence and aggression towards our kaimahi. We have a few reported each month, but probably not as many as I understand the incidents to be happening in the organisation when I talk to people across our hospitals and community services. So I just want to make a push and ask you to encourage your teams to report health and safety events and incidents through Datix. Use the health and safety drop-down boxes. It really helps us understand what's happening, and it helps us target where we want to put interventions in place. We're going to be doing some work around violence and aggression prevention and de-escalation training. We have a free training module for staff available now. It's an online, I should say, module available through eLearn. It doesn't take too long to do, but it does provide you with some basic skills and knowledge around de-escalation, and it's suitable for everybody wherever you work. Some people, they will need more training than that, and we're working with the regional and national health and safety teams to put in place some face-to-face training, as well as some further online enhanced training for people that need a bit more. But everybody should be doing the de-escalation and safety module. So again, if you could have a discussion with your teams about that, that would be really helpful. Our numbers of completed training at the moment is quite low, so I think getting that lifted would be great, alongside getting reports of the events when they're happening completed as well. For those of you that are health and safety reps or have health and safety reps in your team, if you could just as well take a look at the health and safety rep training that we provide. So this is only available to elected health and safety representatives, but it gives you the knowledge around the job. It also leads to a qualification that enables you to do the full aspects of your role under the health and safety at work legislation. So it's really important that you do complete it if you're a health and safety rep. If you manage a health and safety rep, so if you've got somebody in your team that is a health and safety rep, we should be releasing them to do this training. So we need to be facilitating their time away from their normal work to go and do this training. It's I think it's 2 days in total. So again, encourage you to have a conversation with your health and safety reps to find out whether they've done the training, and if not, work with them to find a time where they can go and do that. The training dates are available and they're booked. There's a couple more left for 2025, and there's more booked into 2026. So lots of opportunity to plan ahead and get that training done. And then kind of linked to health and safety is well-being. Some of you who have been here longer than me will recall the Wellbeing Index, which is a health roundtable data set and information that comes to us through employee and kaimahi participation in a monthly wellbeing survey. I think over COVID, we shifted our focus away from well-being, holistic well-being, into more around infection safety and protecting our employees around exposure to the virus. What I would like to do now is start moving to focus back again around well-being. We still have access to the tool from the Health Roundtable, and I've recently downloaded it onto my phone and completed my first questionnaire. It's really quick and easy to do. It takes about 3 or 4 minutes to set yourself up with your profile, selecting that you work in Health New Zealand Te Tai Tokerau, picking your age and gender so you can get some more tailored results, your profession and physical place of work. You only have to do that once, and then the survey questions take 90 seconds, 2 minutes, and it's a monthly thing to do, and the app will, if you allow it, will send you a reminder each month to do that. But what that does is twofold. It gives you some personalized information on your well-being across a number of different domains, and it shows you where you sit on a bit of a barometer against other people that share similar characteristics to you, so gender, age, and employment. So whether where you sit against other nurses or other doctors, or where you sit against the rest of the New Zealand population. And I think that's really helpful because it allows you to access support if you're sitting in a kind of more of the red zone than the rest of the population. It might trigger you to think, actually, I probably do need to get a bit more support around well-being, and the app can signpost you to where those supports are. Or if you're sitting better than the rest of the population, again, allows you to reflect on that and see where you are. What it does for us as a leadership team is it allows us to see at quite a high level how our kaimahi are feeling and how their work is potentially impacting their well-being. So what we can see is we obviously can't see anybody's individual questionnaires. We can only see it at a district level, so the whole of Te Tai Tokerau, or we can break it down by profession, so by doctor, by nurse, by allied health, by admin, etc. Or we can see it by department. And if there's enough people that have completed the questionnaires in each department, we can break the department down by profession as well. But we need enough people to do that just to maintain confidentiality. So all your results, all your questions that you complete are completely confidential to you, but the data goes into the data set to allow us to see how we're doing. What we would like to do is get enough people completing that we've got a really reliable data set, and then start working with individual departments, wards and services to talk about what are the things that we could do as an employer to support your well-being at work, make those changes, and hopefully see the change come through in the monthly results and see an improvement in people's overall well-being. So you will see a bit more comms come out over the coming months. You'll see some posters which have QR codes for the both the Apple and the Android versions of the app. You need to scan the QR code and then put in a code when you sign up. It will ask you for your employer code. So make sure you use the Health New Zealand one that will be on the posters. That makes sure that your results then feed into the Health New Zealand data set and allow us to see that at an aggregate level alongside your colleagues that complete it. Any questions, feel free to come through to me or talk to your general manager or clinical lead about it, but we'll be getting a bit more comms out. So really this is just the start of that, and we'll be putting some more information on Staff Central. I'm sure you'll be seeing screensavers and other emails going out about it. We really want to get as many people using this as possible because it's much more reliable and much more useful when we've got a good chunk of the organisation inputting their results each month. Just talking about other things, I couldn't do one of these updates without talking about health targets. I'm not going to talk in a lot of detail on them because they're available to you each week. Get an updated snapshot of our physical health targets and where we sit relative to other districts in the country. I just want to thank everybody for the amazing work they're doing to help us improve our health targets. There's a lot of work going on to improve performance and reduce our waiting time. So just acknowledging that that's happening across the organisation, and recognise the pressure on some teams and departments to make that week-on-week improvement in health target performance. But it really does improve things for patients when we're able to offer them appointments sooner, or see them in ED quicker, and reduce the amount of time that they waiting for their surgery. So thank you for everything you're doing, and keep up the amazing work. If you've got any other ideas or thoughts around that, again, do come and talk to me or your leadership team. And if you haven't, check out the health targets on the intranet. I would also like to acknowledge our cervical screening team up here. So Claire Forrest and Co, who have been doing some amazing work in the community to increase the uptake of cervical screening. So the screening programs that we've got in place are really important in helping us detect and treat patients sooner. And one of the concerns that we've all shared, I think, in Tai Tokudo is that our screening rates are sometimes lower than we would like them to be. And that's particularly true for our Māori and Pacific populations, who often have screening intervention rates much lower than Pakeha and non-Māori, non-Pacific communities. So I was really pleased to learn recently about our cervical screening improvement, and I think it's grown by almost 15% improvement in uptake over the past year, or over the past 2 years, which is just phenomenal. And I think just goes to show the amazing work that those teams are doing out in our communities, engaging with people, engaging with iwi and other providers to encourage people to respond and participate in the screening program. So a huge thank you to those of you doing that work. I think sometimes we talk about health targets a lot, but things like screening and early intervention are really important for the long-term health outcomes and health improvement. So I think we need to celebrate those successes as well. So congratulations to the team for the great work you've been doing and improving that. And I'm sure that you'll be continuing to build on that and continuing to grow our screening uptake rates. And another thing to celebrate is our diabetes team. So October the 1st marks a year since the introduction of publicly funded insulin pumps and continuous glucose monitoring for people with type 1 diabetes across New Zealand. So we know that Northland has a particular challenge with diabetes and patients in our community with type 1 and type 2 diabetes. And our diabetes team and community teams have worked really hard to engage with our patients and roll out the continuous glucose monitoring devices to them at home. So we've now got, I think, over 150 adults and 26 children accessing insulin pump therapy. And I was really pleased to hear that we have the shortest waiting time in the country. So for a community and for a district that perhaps has some of the poorer health outcomes and higher rates of diabetes in the community, to have the shortest waiting times is phenomenal. So again, shout out to that team and for all the mahi they're doing, and a massive thank you. And I think it just shows what can be done when our teams come together to solve a problem and solve a challenge and work with the community and work with partners across Tai Tokudo to deliver some real change. So huge thank you to you all for the work that you've done. I think that's it from me. I'm just going to make a plug. There's a national all-staff hui, not with me, thankfully, but with our leaders on the 8th of October at 1:15. So Dale will be there, and maybe a couple of other people popping in. It's sometimes tricky to get these invites out to everybody, given how many people are in Health New Zealand. So you should have seen it via email, but if not, we'll put it in there. There'll be some more emails between now and then, but pop in your diary the 8th of October at 1:15. I think it will be recorded as well, as I expect it'll be recorded and you can watch it later if you're not able to make it at that time. But if you are able to, please log on and have a listen to what Dale's got to say. All right, thank you for listening to me for the last half an hour. I will open it up to any questions or comments, or if there's anything else I've not talked about that you would like me to talk about, now's your opportunity. Pop it into the chat on Teams, or feel free to put your hand up and we'll come to you on the screen. If not, a quiet group. I'll just give you another few seconds, just in case somebody's typing away. All right, doesn't look like anyone's got any comments, so hopefully I've covered everything that you came here to hear about. If not, you know where I am. I'm on level 3 of the main hospital building, so you can always pop by and say hello, or drop me an email directly. If there is anything you want me to cover in these sessions, then do drop an email to the communications team who help me pull together these updates each month, and I'll happily cover it off next time round. Otherwise, thank you all for joining, and I will just close with Kadaki and enjoy the rest of your afternoon. Unihia ki te uru tapanui, kia wātia, kia māma te nākau, te tinana, te wairua, te ara tangata, koe rā e rongo, whakairia ake ki ranga, kia tina, tina, hui e, tai ki e.